So good day everyone, today we will be presenting our return demonstration about the direct fecal smear test, also known as the wet mouth test. So this test is a laboratory diagnostic test wherein we are going to detect the presence of any suspected microorganism on the stool sample. So in this test, the biosafety level that we'll be practicing is the biosafety level 2, since the microorganisms that could be present in the sample could be a moderately hazardous microorganism. But before we start, we're going to wear our proper protective equipment or our PPE.
Now, before we proceed, let us first perform a proper aseptic technique, which includes decontaminating the work area and preparing the materials needed.
Now, for the materials needed, we needed a Manila paper, applicator stick, microscope slide, dropper, cover slip, NSS reagent, iodine solution,
and stool sample.
In a clean glass slide, put 1 drop of saline solution or the NSS. This is used to evaluate the motility of the parasite, specifically the tropozoites, cysts, and other motile microorganisms. Then in another clean glass slide, put 1 drop of Logos iodine solution. This is to reveal the parasitic structure.
Next, now we're going to put a small amount of the stool sample on the NSS solution. So using a sterile swab applicator, we're going to use one.
Now, using another applicator stick, we're going to get another sample and mix it with the Lugol's iodine solution.
So next is to put the cover slip on the mixture. One for the mixture with the Logos iodine.
And now for the mixture with NSS solution. Make sure there is no air bubbles.
After placing the cover slip on the glass slide, you may now view it under the microscope and see if there is any presence of suspected microorganism.
Performing direct fecal smear technique is a fundamental skill for us nursing students, allowing microscopic examination of stool samples to detect parasitic infections, undigested food particles, and other abnormalities. This hands-on experience reinforces proper technique, infection control, and that will help us in patient care and disease prevention.
Now that we're done with our procedure, as the last step of our return demonstration, we will now be decontaminating our working area, and also we're going to remove our PPE and at the same time dispose the used materials.
Itin lang